Okay. Adrenal lesion characterization. Adrenal gland consists of anatomy, capsule, cortex, and medulla, and the cortex consists of zona glomerulosa, zona vasculata, and zona reticularis. The function of adrenal gland: the glomerular zone secrete aldosterone, vascular zone secrete cortisone, while reticular zone secrete androgen and control the metabolism of fat, protein, and carbohydrate in the body. Secrete male sex hormone and mineralocorticoid, control blood pressure and the level of salt and potassium in the body. Medulla secrete catecholamine synthetase, adrenaline, control the body pressure, blood pressure, and heart rate and sweating. The adrenal regions are very common. Many of these lesions are incidentally discovered and called incidentaloma. Adrenal incidentaloma is defined as mass more than 1 centimeter that is detected on imaging exam not performed for suspected adrenal disease. Most of these incidentaloma are benign, non-functioning adenoma, even in patients with non-malignancy. Adrenal pathology are adrenal masses, hyperplasia, cysts, adrenal hemorrhage, and infection. And adrenal masses include adrenal adenoma, pheochromocytoma, adrenocortical carcinoma, adrenal deposit lymphoma, and myelolipoma. A systemic approach to adrenal lesion. Adrenal incidentaloma are common and seen in about 3% of abdominal CT scan, increasing up to 10% in elderly patients. The issue is to differentiate benign adrenal tumor from metastasis or primary malignant masses without unnecessarily exposing the majority of patients to the burden of clinical workup, intervention, and imaging follow-up. First, determine whether the lesion has typically benign or indeterminate imaging feature. If it is indeterminate, do a washout CT or an MRI to see whether it is lipid-poor adenoma. If it is not an adenoma, then you have to choose between follow-up, PET CT scan, biopsy, or resection. And this diagram يوضح هذا المخطط إنه الأبروش للأدرينال ليجن. إذا كانت الأدرينال ماس الهاوسفيلد مالت يونت مالتها أقل من 10 هاوسفيلد يونت بالان انهانسد سيتي سكان فهي أدرينال lipid rich adenoma. If housefield unit more than 10 housefield unenhanced CT scan, we do washout يعني ننطي contrast وننتظر يعني 10 إلى 15 minute. If الwashout more than 16% فهي adenoma lipid poor. If less than 60% فهي indeterminate lesion and need biopsy. هاي ال CT scan of adrenal adenoma الهاوسفيلد unit مالتها 6 هاوسفيلد فهي أقل من 10 هاوسفيلد فمعناها هي lipid poor adenoma. بالMRI بالT1 تكون intermediate signal intensity لكن من نسوي out of phase راح نشوف إنه drop of signal which mean it is contain fat and it is lipid rich adenoma. أما lipid poor adenoma الهاوسفيلد unit مالتها هنا 16 هاوسفيلد من ننطي contrast صارت 112 هاوسفيلد لكن من ننتظر بالdelayed image يعني 10 إلى 15 minutes راح نشوف إنه drop of signal more than 60% which mean it is lipid poor adenoma. 70% of adenoma, high lipid rich adenoma, 70% of adenoma contain high intracellular fat and will be of low attenuation on unenhanced CT. Using a safe threshold value of 10 housefield on native CT scan result in sensitivity of 17 to 79% and high specificity of 96 to 98% for the diagnosis of an adenoma. فهسه نفس البيكتشر السابقة إنه هذه CT scan يوضح 2.8 centimeter rounded low attenuation mass of indeterminate nature in face out of face نشوف significant drop of signal which mean it is containing fat that mean it is lipid rich adenoma. هذه other picture بالMRI بالT1 هي تكون in face image intermediate signal intensity out of face راح نشوف a drop of signal which is mean it is a mass containing microscopic fat that it is lipid rich adenoma. So confident diagnosis of rich adenoma need one of the following. Either density less than 10 Hounsfield mass Hounsfield on non-contrast CT or normal enhancement and 16-second scan with significant washout of on 10 minutes scan or signal drop on out of face T1 MRI scan compared to the in-face T1 scan. The other image of patient 55 year have nephrectomy for renal cell carcinoma. non-contrast CT scan of abdomen show right adrenal mass هذه that has a Hounsfield unit of -4.5 making the lesion an adrenal adenoma rather than metastatic deposit. Lipid poor adenoma, 30% of adrenal adenoma do not contain enough intracellular lipid to have a density of less than 10 Hounsfield units and cannot be differentiated from a non-adenoma on an unenhanced CT. These adenoma are called lipid poor adenoma. So we need to give contrast, and usually adenoma show mild enhancement compared to tumor and pheochromocytoma. And when we give contrast, see the enhancement in a delay 15-minute image if there is a washout more than 60%, so the lesion will be lipid poor adenoma. هذه ال CT scan of adrenal mass الهاونسفيلد unit مالتها 23 Hounsfield unit. When we give contrast راح تصير 88 Hounsfield unit. بالديلي image يعني 10 إلى 15 minute راح نشوف drop of signal تقريبا 60% which mean it is lipid poor adenoma. هذه other adrenal lesion هم راح نشوف إنها less than 10 Hounsfield unit Hounsfield unit مالتها which mean it is lipid rich adenoma. When we give contrast increase after delay image راح نشوف decrease in signal which mean it is lipid rich adenoma. Adrenal adenoma هذه adrenal adenoma with calcification. With CT scan, we see rounded enlargement of the left adrenal gland with coarse calcification and minimal enhancement. Most likely, it is adenoma. Functioning adenoma هي الكون syndrome والكوشنج syndrome. الكون syndrome هو excessive mineral corticoid production caused by an adrenal adenoma in 70% of cases. Some cases are due to adrenal hyperplasia or carcinoma. هذه Cohen syndrome caused by a small benign adenoma of the left adrenal gland. This patient presented with hypertension and hypokalemia. An axial CT image of the abdomen show a 4 centimeter heterogeneous right adrenal mass اللي هي aldosteronoma هذه الماس. Cushing syndrome caused by excess glucocorticoid production. 70% of cases are caused by adrenocorticotropic hormone overproduction, either by a pituitary adenoma or benign functioning adrenal adenoma in 20%, adrenocortical carcinoma 10%, adrenal hyperplasia or other tumor as bronchial carcinoid, small cell lung cancer. هذه الكيس هو 45 year male with chronic abdominal pain. The patient has type 2 diabetes, hypercholesterolemia, and hypertension. The MRI of abdomen show 4 cm enhancing left adrenal mass of indeterminate signal intensity on axial T1 weighted and increase T2 weighted signal intensity with heterogeneous enhancement in post-contrast enhancement. Adrenal hyperplasia هاي الكيس تشوف bilateral adrenal hyperplasia caused by overstimulation by adrenocortical hormone produced by pituitary adenoma, stress related due to physiologic release of adrenocortical hormone, normal aging process of the adrenal gland. Pheochromocytoma common in the 4th to 6th decade of life who arise from adrenal medulla and sympathetic paraganglia can be associated with multiple endocrine neoplasia, von Hippel-Lindau disease, and neurofibromatosis 1, caused only 0.1% of hypertension cases, elevated urinary catecholamine 97% sensitivity, and elevated plasma catecholamine is 99% sensitivity. Pheochromocytoma تكون 10% bilateral and 10% malignant to occur in children in 10%, 10% تكون extraadrenal familial in 10% of cases do not associated with hypertension in 10% of cases. Pheochromocytoma هو rare tumor arising from adrenal medulla. IV contrast sometimes cause hypersensitivity reaction, so it sometimes not given يعني الcontrast in this case. هذه الكيس هي pre-contrast axial CT of abdomen show a mass in the right adrenal gland. The left adrenal gland is normal. Following intravenous contrast, the right adrenal mass show marked enhancement هنا. ولا هو يقول لك إنه sometime إنه يسوي hypersensitivity reaction الكونتراكس بالpheochromocytoma. هذه other case of pheochromocytoma, a clinical picture of hypertension and elevated urinary vanillin malodilic acid with an adrenal mass make the diagnosis of pheochromocytoma is almost certain. Adrenocortical carcinoma هي adrenal carcinoma are arise from the adrenal cortex, usually produce hormone not sufficient to cause symptom, typically larger than 6 cm and might reach up to 20 cm. Heterogeneous enhancement with calcification in 30% of cases. Adrenal carcinoma can invade the adjacent organ like liver, spleen, and kidney. هذه case of adrenocortical carcinoma in male 42 years presented with abdominal distension. Axial CT scan show heterogeneous 11 cm left adrenal mass containing calcification infiltrating the upper pool of the kidney. وأيضا أكو liver deposit and ascites. الادرينوكورتيكال كارسينوما الديفرنشيال diagnosis مالتها metastasis لكن typically يكون smaller. Pheochromocytoma typically يكون symptomatic. Renal cell carcinoma the main bulk of the mass يكون in the kidney يعني. الادرينال gland metastasis يعني is common and يعني deposit most common originating from the lung, breast and the skin primary. Non-specific imaging feature, absence of signal dropout on the opposite face image, or differential diagnosis include pheochromocytoma, adrenocortical carcinoma. A non-primary tumor or evidence of metabolic activity is helpful to reach the diagnosis of adrenal metastasis. هذه adrenal metastasis from lung carcinoma بالultrasound وهنا بالCT scan adrenal metastasis. هذه other adrenal metastasis بالnon-axial عفوا axial contrast enhanced CT show massive adrenal metastasis from malignant melanoma, bilateral adrenal metastasis. هذه case of bilateral non-Hodgkin lymphoma, enhanced axial CT scan image show bilateral involvement of adrenal gland in patient with non-Hodgkin lymphoma. Myelolipoma, benign tumor composed of bone marrow elements. Usually they are easy to recognize on CT or MRI because they contain area of macroscopic fat. calcification seen in 24% of cases, while adrenal masses seen on CT contain macroscopic fat, which is specific for the diagnosis of myelolipoma. The adrenal myelolipoma 10% تكون associated with endocrine disorder like Cushing syndrome, congenital adrenal hyperplasia, Cohen syndrome, hyperaldosteronism. CT scan هذا shows a fat containing lesion that has replaced the right adrenal gland. هذه myelolipoma, الadrenal mass here contain macroscopic fat which is specific for myelolipoma. Other lesion of adrenal gland was cyst, uncomplicated cyst is well-defined lesion of water density that does not enhance. Cyst has thin wall and may have thin septa. It may be an endothelial cyst or pseudocyst, which are the most common, or true epithelial or parasitic cysts تكون rare. Pseudocysts may have thick wall. هذه CT scan image of adrenal cyst. هذه other CT scan showing left adrenal gland cyst. Differential diagnosis either endothelial cyst, epithelial cyst, parasitic cyst, or even gastric diverticulum. لكن إذا كان diverticulum راح نشوف الكونتراست موجود داخل السيست أيضا. Adrenal hematoma, 90% of traumatic hemorrhage occur in the right side due to compression of the adrenal gland between the spine and the liver. Hemorrhage has a rounded or oval shape in up to 82% of cases. Residual adrenal pseudocysts may persist in an oncologic context. Adrenal metastasis should always be considered. الهemorrhage either traumatic or non-traumatic. Non-traumatic either due to anticoagulation or stress related to surgery, sepsis, hypotension, or idiopathic, which is rare. هذه CT scan image of right adrenal hemorrhage. هذه calcified right adrenal gland due to a prior trauma. Adrenal TB, both adrenal gland and contain specks of calcium. This is highly suggestive of tuberculosis affecting adrenal gland. Tuberculin test in this case for tuberculosis was strongly positive. The case of adrenal infection proved it is TB. And thank you.